Here at Remar Review for Monday Motivation. Let's talk NCLEX. Listen, let me tell you guys, I have the motivation. I have the NCLEX that you've been waiting for. This is what you've been waiting for. Yes, we're live. Come on in, Remar nurses. We have an amazing segment right here. Yes, we're doing Monday Motivation. I'm so happy you're here, Takia. I'm so happy. Hi, Candace. I knew Candace would be here with me on this Monday. Let me tell you guys this. I have the Monday Motivation. I have the NCLEX material, but I also have a real live testimonial from a real Remar nurse that is going to inspire you. And it's not just a regular, I passed NCLEX. This is an amazing I passed NCLEX with complications and failures and everything. And I'm telling you guys, this is going to be a blessing to you on this Monday morning. Hi, Takia from Mississippi. Hello. It's probably a lot warmer in Mississippi than it is here in Ohio. I'm glad you guys are here globally, internationally. Let me just show you our beautiful Remar nurse that will be joining us. I just want her to come on and just wave. She doesn't even have to say anything but this testimonial. Wave to the Remar family. That's a brand new Remar nurse, Nurse Daphne. Oh, I can't wait for you guys to hear her testimonial. Matter of fact, let me bring her on. Let me just make sure that we can hear her. So can you say something? Can you say hello, Remar nurses?
Hi, Remar nurses.
Perfect. Okay, so you guys will see her. You will see her in a little while, but right now we have to welcome everybody. We have to welcome everybody from everywhere. This is Monday Motivation. Let's talk NCLEX. If this is your first time here, my name is Regina MSN. I am the #1 NCLEX instructor in the world. We have the #1 staff here at Remar Reviews on this planet. And we also have amazing Remar nurses from all over the globe representing in real time the journey. Nurse Alberta. Hi, Regina. I just passed my NCLEX with 75 questions. Thank you for 7 days of NCLEX and quick facts. Oh, it was my pleasure. 7 days of NCLEX was the funnest event I had done in 2018/19. Hey, Valerie from Florida. Come on in, Remar nurses. This is your Monday Motivation, and it's a hot one. I'm here. If you had a challenging weekend, it's a new day. This is a brand new day that you have never seen before. What a blessing. What a gift. So what are you going to do with this day and for the rest of the week? Oh, I got a long testimonial here. Nurse McClendon. Listen, Nurse McClendon. Okay, so I got one from Nurse Seiko. My name is Hannah Aru, graduated 2015 from Cameroon. Just passed my boards on the 4th of January. Congratulations, nurse from Cameroon. I can imagine how challenging that was. Fun. Don't be nervous. Everybody that's testing, we're going to encourage you and uplift you. I know there'll be more testimonials coming on, but I got to get started. So, okay, one more. Nurse Lewis. I passed NCLEX first time I watched during the 7 days of NCLEX. Thank you. Thanks for all the info and explaining it so well. Thank you for coming on here and sharing your testimonial. You are a nurse. You already have this amazing path now that you can walk in. Oh, but the studying that the rest of us have to do, we will continue to do together. Being happy for all those who passed, congratulating you guys for the success and sharing it with your family here. We are truly happy for you. If nobody else is happy for you, we are happy and excited for your success and you accomplishing this incredible goal of passing NCLEX. Oh, I know it feels so good. Your time, if you have not tested yet, is coming. It's coming up, so you better get prepared for it. Okay, let's go. Monday motivation. Investigate your actions. Investigate your actions. We are getting into this week because 2019, this is our year of our own accountability. And in order for you to be accountable, you have to take inventory of what you are doing. So today you're investigating your actions. I like this topic. It helped me so much. So just quickly, some things that you got to do in order to investigate your actions. Number one thing is this week, today, right now, this morning, identify the issue that you need to address. And for everybody, it's a little bit different. We're all on a journey of passing NCLEX, but there is something this week that I want you to be cognizant of. And it's identifying an issue. I'm going to give you the top issue that I think it should be, but you may have something different for your own self. But this is the question when I talk about identifying an issue. In the scope of NCLEX, are you giving your NCLEX preparation your all? Are you giving it your all? Can anybody just come on here and say yes or no, I am or I am not? Are you giving your NCLEX preparation your all, your everything? What? Like seriously, are you giving it your all? And as I'm looking for the answers, the reason why I'm asking this is because we have this NCLEX grief form. And typically we give, Donna says, no, I'm not. I appreciate the transparency. For everybody that can say, I'm not really giving it my all. We have this NCLEX form. It's a grief form. And usually if somebody comes to me and they say, Regina, I did REMAR, I failed, or I didn't do REMAR, I did something else and I failed. 100 times out of 100 times, I'm sending them this grief form. And what I like about the grief form is it is a self-evaluator. So if you get the grief form for me, one of the first questions is, did you give NCLEX preparation your all? Like everything. Another question is, how do you know that you did that? Right? Really investigating yourself. That's what I'm talking about this week. The third question on the NCLEX grief form is, if you could go back, what things would you do exactly the same? Like what things would you do differently? Some of you guys have seen this grief form, but the point is that right now, today, you should be able to determine, I'm doing everything I can for this exam. Or you should honestly be able to say, no, I'm not. I'm letting things get in the way. I'm not focusing. I'm prioritizing things that have really little consequences in the grand scheme of things over this NCLEX. And so for this week, I want you guys to prayerfully and carefully investigate your actions when it comes to this exam, right? Is there something that is keeping you from giving this your all? Is there something that's keeping you from giving this your all? And you can get this form. Actually, if you want it now, we'll put it in the link where you can download this form and go through the questions for yourself. All right. And it's better to have it. I mean, really, it's better to ask yourself these things even before you test than after you test and fail. You don't want to get this from me, because if I give you this, then it means you failed. But if you get it right now, then you're getting it, and you're actually able to evaluate yourself. And I saw here that somebody lost a loved one. So we just want to send our condolences here on behalf of the REMAR nurse family of the one that you lost. And we're praying for your family, that you have comfort. We actually have our staff meeting today in the afternoon. So we'll pray for you and your family as well. Okay. But so we're talking about identifying where we are and asking ourselves the question, are we giving our NCLEX preparation everything? And this can be an issue. This should generally be a universal issue, but also there's some other things that I put on here too. Because while we're asking ourselves, are we giving our NCLEX preparation our all? Are we detoxifying our diet? Because that goes along with it. Really, really, it truly does. What you're eating while you're studying is going to affect how much you retain. It's going to affect how much energy you have to study. Like a lot of us, we can eat something and it'll give us a boost of energy, and we're going hard at our studying for like 20 minutes or 30 minutes. But then once we have that crash, we have no more concentration for our exam. So for our studying. So it sets us back. It sets us back in a way, right? So somebody said, this motivation is for me. Yes. Are you detoxifying your diet? Are you drinking enough water? Are you really taking care of yourself? Because during the process of reaching your goals and caring for everybody else, nurses, we put ourselves on the back end. We put ourselves on the back burner, you know, and we're not being kind to ourselves. And so by the time we take the exam, we're like raggedy messes because we just been so focused on just studying and then taking care of other people, and we're not really taking care of ourselves. Okay. Also, ask yourself this question. Are you following through with your own plans? Are you following through with the things that you say you were going to do in other areas of your life? Are you keeping your commitments in other areas? Because that is going to translate to what you do for your own NCLEX exam, right? It's your personal accountability. Are you keeping your word? Are you keeping your word in general? All right, let's just be truthful this week. I'm happy for you guys that can say, yes, I'm doing everything I can. Continue to do that. Continue to grind it out, because as Nurse Daphne is going to tell you, it works if you trust the process. If you commit to the goal, you will reap the rewards. But it has to be, it has to be followed through. So Nurse Lemon, guys, Remar is the real deal. I tested Friday and got my unofficial results yesterday and passed. I am a Remar nurse. Yes, perfect. Oh, is there any more testimonials? Yes, Miss Reese. Hey, Regina, I passed my NCLEX Tuesday, 85 questions. Pow. To God be the glory, and thank you and your husband. He definitely used you both. Another Nurse McKelvey, I am a repeat test taker and passed my test 117. Wow, that was just a couple days ago, 2019. I'm a Remar nurse. Thank you so much, Regina and staff. Wow. Thank you. Nurse Katie, thank you for all you do. I took my NCLEX Friday and I passed. Nurse Katie, thank you for coming on here. Is there any more? You guys, oh, wait. Okay. Nurse Kamara, hi, Angel on Earth. I just passed NCLEX last week. I took the exam on Monday the 14th. After 4 times, I graduated 2012. Woo. Thank you so much, Regina and Mark. God bless. Wow, you guys, amazing. Thank you for coming on here. The grind is real. The grind is real, but the success is real too. Amazingly amazing. Just a testimonial flood. Thank you guys. Oh my goodness. Okay, so we're talking about Monday motivation. I'm going to ask you guys too this question. Why is it important for you to pass this exam? Let's go back to the why. Why is it important for you to get to the other side of your exam? What is it? Who is it for? Is it for yourself? Are you doing it for your parents? Like what? You have to tap into that why, because that why of why you're doing it is going to give you the energy and the motivation that will be consistent and daily. Like I'm coming on here on Mondays to help prepare you guys for the rest of the week. But your why, if you're looking at your why every day, if it's your kids and you're seeing your kids every day, that's going to give you the energy to study and the motivation to study. So Valerie says, I'm doing it for myself. Exact. I get that. I get that, Valerie. I'm right there with you. There's this thing. So let me be transparent with you guys. I am working on trying to get my PhD, right? I need to go back to school to get my PhD in nursing. Why do I need to go back at this time in my life when I got a trillion other things, a million projects, but I have to do it for my own myself. And in order for this to get done, I have to be committed to this goal, because there's a million reasons why I don't have to get a PhD, right? But it's a personal goal of myself. And yes, it's very scary. And yes, I have to do a whole bunch of studying, but I can do it if I stay committed to the goal. So I'm right here with you guys. Like, we're encouraging each other as we proceed towards our goals, right? So if you find out your why, I really like this here. It's just a saying. When the why is clear, when you clearly have your why, the how is easy. How you get it done is easy when you understand why you have to do it. You just do it. You grind, you grind, you grind, you grind, you grind, right? So, in general, this week, I want you guys, again, to look at your own actions. What are some things that you need to do in order to keep this a priority? What are some things you need to cut out? What are some things you need to cut out? What are some things you need to add to make sure that you're not only faithful to this goal, but the other things that you say you're going to do? Let's just be better people in general in terms of our accountability, Yes, I'm with you too. I'm doing it for my mom. I like that. All right. So also, one more thing, download the degree form. It is in the description of this video. I think this is a worthwhile tool. Usually we give it to students after they fail the NCLEX exam, but let's do it differently. Let us get it today for our own selves to assess where we are. The phone is distracting you. We're looking at our distractions. Okay. All right, we're going to get into some NCLEX questions. Yes, of course, we're going to get in some Let's Talk NCLEX, some NCLEX questions. But let's talk NCLEX. Let's talk Pay It Forward. Let's talk our featured guest today. One of the things about Remar Review is that our nurses are real people. They're not paid spokespeople for the company. They're real people that you guys can relate to. And they are beautiful and amazing because they take time out of their super busy schedule to speak to, they speak to us and let us know exactly how they did it. What was their motivation? What was the encouragement? So I'm bringing on two guests. One you guys know is part of Remar staff here. We know him to be our spiritual chaplain here at Remar Review. So
what's up, guys? What's up?
So we got Elder Mark Callion here with us, and we have a Remar nurse, class of 2019.
Bam.
Isn't she beautiful? 2018. Oh, 2018, but representing 2019. That's right. I'm counting her for 2019. Nurse Daphne, say hello to everybody.
Hi.
Yay! Yay! So. We're happy to have you here.
We are so happy to have you. Congratulations on not only passing NCLEX, but really being a Remar nurse and embracing that idea of giving back and paying it forward. And your journey is unique and it's special, and we want to share it. We want to share it with the family. So thank you for being a Remar nurse. So tell us a little bit about your nursing journey. When did you graduate, and kind of what was your steps from there in finding Remar after that?
Okay, so I graduated in May of 2018 recently. And then, so the first time when testing, I just did UWord only, just questions only. But I didn't know any content, no content at all. The second time I did the online academy. And that was
Remar Online Academy. Okay.
And then the second time, I mostly did just to get through it. I wasn't really studying or reapplying information. And I didn't pass the second time. And so for the third time, my online had expired. So I contacted your offices, asked for the DB self-study program so I could learn the material again. And then I did the your question bank, the study package, and then I passed the last third time.
Okay. So just to recap, you are a pretty recent graduate, 2018, right?
Yes.
May 2018.
Right. And the first time you sat for your exam, you only did questions. You found New World, you only did questions. What made you take that approach to your studying for NCLEX?
Because I had a lot of classes ahead of time. They said that just to U World. And they said U World to be fine, but that didn't work for me at all.
So your school didn't have like a specific review process. It was kind of just up to the students in a way.
We had a 3-day review course, but it wasn't really informative. It was more really rushed. So a lot of us left like kind of still iffy about it. So a lot of us things with other stuff.
Okay, and that makes sense. And I think that's one reason why Regina always says that the real work of passing NCLEX is done at home.
Yeah.
So, I mean, you can only do so much in 3 days. Even if you cover everything, it's not enough to give like an in-depth study of the material. And it kind of left you feeling, vulnerable and looking for other resources.
Yeah. So talk to me, because after you failed, how did you find Remar Review?
I had a coworker here. She actually referred me to the Quick Fact book, but I wanted more. I didn't think it was enough for me, so I wanted your website, and then I was looking up the product you had. And I just bought one, and then I kind of did my study. Okay,
so you chose the online academy. You chose the online academy. You went through. I'm using your words. You went through the online academy just to finish it. What does that mean? What does that mean? You went through it just to finish it. Like, what did that?
At the end of your study count, you have us review all the material we learned. So I wouldn't review it. I would just do it. Pass. Yeah. So that was my big mistake right there.
Okay, so then you took NCLEX again. You didn't pass with the online academy. Now, with the online academy, there is a money back guarantee with the online academy. What made you not seek the money back guarantee? Because a lot of people, they think, okay, if I do the program and I don't pass it, then I'm just getting my money back. I'm done. Yeah. But you didn't take that route. Like, you called in and asked for the DVD package. Like, what made you want to stick with Remar after not passing that second time?
So I really liked how your program was very inclusive. It was easy to learn. The content was all there. So it's not like I knew my approach. I knew I was on the right path, but I just didn't put my effort into it. So I was like, I'm going to try one more time again. And I passed.
Got it. Wow. That's phenomenal for not giving up on yourself, going back to the program and saying, okay, I didn't do what I was supposed to do. Let me try it again. What did your... what was the struggle like of failing NCLEX, having to tell people you failed it, and then continuing to study for it?
It was hard. I mean, I come from a very traditional, reserved family because I'm Haitian. So the first time I took it, I didn't tell anybody. I just kept it to myself. The second time was the same thing, but the third time I was like, I need prayer. I need to believe. I need to ask for help. And so I did that. And so I let my parents know, and I let the pastor know. I was like, I really need some help, some encouragement, because it's hard, You graduate recently, all your friends pass, and you're like, oh my God, what did I do? What's wrong? So I put my faith in first. I prayed, and I just really, really studied until I made it.
Love it.
I love that. I love that as an encouragement for others who may be on the same journey. You passed on your third try. You didn't give up on yourself. And I like seeking the help with prayer. Talk about the weeks of preparation. Like, what did you do differently? What did you do specifically differently with that DVD package? The third time that you studied it, did you follow the calendar? Did you set aside time, or did you go to a quiet place? Like, what also did you do that you could take responsibility for? Because the prayer, that's God.
Yeah, it is. So I remember I was still working full time. And so right after work, I would go to the library and just study. But I wouldn't overwhelm myself. So I would just do 2 to 3 hours and I was done. Instead of being there for the whole entire day or for the whole entire night. And that really helped me because I was able to remember more and understand the content. And so I made sure that I really followed the study guide. I really made sure that I understood everything I was going through to make sure that I was on the right path.
Nice.
That's amazing.
I know. I'm like, oh, so okay. So I don't want to. I know you have places to be now and things. Okay, can you just tell me how did you? Okay, so you're coming down to your exam. Did you have nervousness? Were you nervous? Were you anxious at all?
Yes, every time.
Every time. And how did you deal with that?
When I was taking it, there were times where I didn't know a question, and I was like, you know what? Gonna pray. I'm gonna reach my best. And so I would do a quick little prayer. I would step out, get a drink of water, and I would go back again. But the nerves were always there, honestly. But you have to. But I think for me, one thing that I really learned is that sometimes they ask a question of when you know the answer, but your nerves are just so high that you just miss it. Mm-hmm. So I was like, Daphne, calm down. And I read it again, and I was like, this is the answer. This is what I learned from my content, so I do know this answer. And I was like, I got this.
Oh, that's so amazing. So the content really helped you carry through your exam. How many questions did you have?
265.
There you go. Yeah. All of it.
The whole 5 hours.
Wow. So you got exposed to the maximum number of questions and you hung in there.
5 hours.
5 hours deep. Wow. Prayed your way through. Listen, somebody needed this motivation today. I know somebody needs this motivation. This is what I'm talking about. When you go in there, don't expect to have 75 questions. Go in there expecting to go 12 rounds and coming out a champion. Oh, man.
Yeah.
Beautiful.
And what I love is just like her sharing this testimony and seeing the smile on the other side.
Yeah.
So on the front side of the test, you have nervousness, you have anxiety, you have, deep, heartfelt, concentration. But on the other side, it's just, smiling and praising God and then paying it forward to saying, hey, and encouraging somebody to say, hey, you can do this. And it's just such a blessing to be able to see that and to be able to witness and experience that with you. Now, during part of the study process, you sent Regina an email early on and said that you made a promise to God. And what was that promise that you made to God?
I promised God that I would pay for the board for somebody else. So I would help somebody take their boards.
Wow.
Amen.
Wow.
Amen. And so we started the year off 2019. Regina covered 19 students, 19 Remar nurses in terms of paying for the boards. Yep. And we said that we wanted to do it as an example.
Yes.
That specifically as an example, because we weren't even going to do that much. We were going to help maybe one or two, but they said, we have to do more in order to be an example. And clearly it's working, and God is sowing seeds into others. And so she made a commitment even before we did this, that if she succeeded, that she would help somebody pay for boards. So the next Monday, when we come back on, we will have the name of that individual. And then I know Regina's going to add to that. And so we'll have two names of somebody that has received the package and that's somebody that's studying, and make sure that their boards are covered. So Remar nurses give back. It's more than just, passing NCLEX. It's more than just, getting the job you want. It's about putting yourself in a position to be a blessing, a blessing to somebody else, and really being able to just, pay it forward. Yeah. And that's what it's about. So Daphne, thank you so much for being a part of the Remar Nurse family.
Absolutely, it's a
pleasure. And we know that we're praying for some things that career-wise, everything that you're looking for is able to be to line up. That you're able to have the position that you're looking for, the favor in the position that you're looking for. And then also that your career will be an extension of God's arms and a blessing to all individuals that you come in contact with.
Absolutely. Thank you. Absolutely. The journey that you've been on, I think, to get your license is just preparing you. It's just preparing you to have an amazing. Sometimes we think like, oh, why did this happen to me? Or why am I going through this? But really, when you come out on the other side, you're a different person. You have a different perspective. And so I'm just looking forward to amazing things from you because you already get the idea of reaching out a hand to pull somebody else up to where you are.
Absolutely.
So.
And the struggle only makes it that much better.
Yes, 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 yes. So thank you so much for joining us on Monday Motivation. Many blessings to you.
Thank you, guys.
Bye.
God bless.
Bye. Okay. What a wonderful segment.
Absolutely.
Oh, my goodness.
Absolutely. Paying it forward. Now, listen, it's time for some NCLEX questions.
Yes.
Let's get right into it.
Okay, so here we go. Get out paper and pencils. You might want to take some of this information down. Here we go. A nurse in wait. But let me preface this really quickly. This is an Ask Remark question. A student sent it to me. Usually I don't like to do questions from, different sources, but this one I took some time to do, and it says, a nurse in an adolescent psychiatric unit was doing a discharge to an adolescent, and he stated to her that the nursing on the night shift invited him to a date. All right, I'm reading just as the student gave it to me. What is the best action for the nurse? So a nurse is discharging a patient on the psychiatric unit. The patient says the nurse invited him out on a date. What is the best action by the nurse for this complaint from a patient? Is it going to be A, report to the nurse supervisor, B, report the nurse to the Bureau of Ethics, which is what the student was asking me about, C, tell the client that this is an effect of his meds, or D, confront the nurse? So when I got this question, she sent me this question like this, and she said, what's the Bureau of Ethics? When do I report to the nurse supervisor? I don't know what to do in this situation. So I said, okay, let's look at it all together. So when a nurse receives a complaint from a patient about another staff member, the responsibility of that nurse is going to be what? I see different answers here. I see between D and A. I see between D and A. So the correct answer, you guys, is to report this to the nurse, okay? Supervisor. All right, you got to report the nurse to the supervisor. And the reason why you don't confront the nurse is because that's not your responsibility. You don't get paid to handle other staff members, right? That is the responsibility of the nursing supervisor. So the best thing that you can do when a patient complains about a staff member, whether it's another registered nurse, whether it's a licensed practical nurse, whether it's the nurse's aide, whether it's a volunteer, you need to take that to administration or the manager. So that would be the nurse supervisor. And yes, even if the patient is psychiatric consult, even if the patient has Alzheimer's or dementia, like, you have to take complaints seriously. NCLEX wants to believe that you will do the right thing in all situations. So remember, this is by the book. This for NCLEX is by the book. So if somebody comes and says, hey, I was sexually molested, listen, it doesn't matter if they have a diagnosis of paranoid delusion, schizophrenia, post-traumatic stress disorder. You have to take that complaint serious. So any kind of sexual advance has to be reported to the supervisor. So this is a very, very, very great question for us to discuss on Let's Talk NCLEX, just knowing our responsibilities. We don't handle conflicts between staff members or patient and staff interactions. If two staff members get into an argument in the hallway, your responsibility is to report those staff members to the supervisor, okay? Confronting somebody is very aggressive and hostile. And in the workplace, it can be interpreted as many different things, usually not good usually not good. So even if you choose to confront a staff member, when you report the staff member to the supervisor, you're going to also have to report that you confronted that staff member about the accusations. And that's going to be totally out of line. You're going to be the one who ends up getting in trouble for doing something like that. Okay. So it is when the nurse has taken it above them, if necessary, once you report. Yes, absolutely. Because once you, the question was asked, wouldn't the nurse supervisor take it to the next person higher? Yes, because when you take something to the supervisor, then the supervisor has the responsibility of investigating the claim. That's part of the management. That's part of the management. If somebody brings a complaint, then they have to have solutions to investigate that complaint. So in general, you don't confront the nurse. There is not a time when it's okay to do that. You would not do that. Okay. So there we go. Because it's not something, it's not a matter. It's not a matter for you to resolve. If a nurse acts inappropriately, it's not your responsibility to correct that nurse's behavior. So that's why. Okay. All right. So we're all together on this, almost 600 nurses on this broadcast. We're talking about conflicts amongst staff members based on behaviors. The bottom line, give it to the nurse manager. Let her handle her staff member. Let her handle her staff member. Now, this is a great question. What if it was a conflict between two workers? Would they talk it out or just go to the supervisor? Well, now we're getting out of the realm of NCLEX per se and into more real life scenarios. And if a registered nurse, and let's say this, if a registered nurse, let me try to think of a good scenario. Okay. A registered nurse is delegating. I'm the registered nurse. I'm delegating a task to unlicensed aide. And I find that the unlicensed aide is not doing the task that I'm delegating. Then I have the responsibility in that scenario, because these are my tasks that I'm delegating, to speak to that unlicensed aide to ask, what is the issue? Is there an issue with understanding? Do you not feel like you're capable of doing the task that I'm asking you to do? So I would speak to that individual because it is a personal problem between myself and the person. But if I get a report about another staff member's behavior that has nothing to do with myself, then I have to report that behavior to the supervisor. So if somebody tells me that the aide is showing up to work intoxicated, drunk, I need to report that to the supervisor, right? So, so that's that. Okay. If you find that the nurse is doing drugs, you don't confront that nurse. If you don't confront that nurse. Now, if the nurse is caring for a patient, you have to protect the patient. You have to remove the meds, but in the perfect world, you let the supervisor know that you heard that report. All right. So I hope that is acceptable. If you still have questions, let me know. Let me know about that. Okay. Great interactions. One of the best things about these lives are the dialogue that happens, and also, the things that we learn from each other. So continue to discuss it amongst yourselves. And then I'll jump in as I see things. I want to talk about the subject of pharmacology in the psych scope. Okay, I want to talk about some psychopharmacology, looking at an antidepressant, because if you guys are studying with the DVD package or the online academy, I do talk about the benzodiazepines, the typical versus atypical, and then the two psychiatric antidepressant medications that I go over are SSRIs and MAOIs. But today I want to talk about the TCAs. All right. So this is the tricyclics. These are also used to treat depression, as well as other things that I'm going to talk about. You can see TCAs given for other reasons if you're doing NCLEX type questions. So how TCAs work are pretty similar to the other antidepressants, such as SSRIs and MAOIs, but specifically the TCAs are going to focus on serotonin and norepinephrine, okay? And when I say they increase serotonin and norepinephrine, essentially it just means that when serotonin is released into the body, it's broken down very quickly. It's broken down and the body gets rid of it, right? But when you're on a TCA, then it blocks that breaking down of the serotonin, right? So you can have it in your body for a long time. And serotonin is one of those things that make you feel like you're in love, right? And norepinephrine is going to keep you up and keep you happy. Like these things together will keep you happy. Now, one thing about the TCAs is that they block a lot of other things. So they block serotonin and norepinephrine, which keeps you happy, but there could be a lot of interactions. Write this stuff down if you're taking notes. The TCAs will also block potassium and sodium, right? They will also block potassium and sodium. So, if something is blocking potassium and sodium, you know that it's going to lead to some cardiac changes, right? Cardiac changes with the TCA. So you want to know what they are. I'm going to tell you what they are as well. TCAs are also a histamine blocker. So they kind of act like Benadryl. If you guys think of how Benadryl makes you feel when you take it. Does anybody take that? If you think about how a histamine blocker makes you feel, then you will also be able to anticipate how if you take a TCA antidepressant, how you're going to feel. And the histamine blockers make you feel super drowsy. If you take Benadryl. Some people, when I was a travel nurse in my younger days, and I had to fly places, I would take Benadryl so I can sleep on the flights, especially if they were long. Okay, so we're talking about tricyclics. We're talking about this group of antidepressants. I really want you to add this information to your notes because it will help you if you see this on your exam. Oh my goodness. Okay, so we're talking about this. What else shall you know? Well, you need to know the examples of tricyclic medications. Get out your flashcards. Oh my goodness. Because we have amitriptyline, we have nortriptyline, we have protriptyline, and then we have desipramine, imipramine, and clomipramine. I like that. She says, I literally have to be in bed when I swallow Benadryl. I know. Tell me about it. Okay, so these are the TCAs that you want to be familiar with when you see them. These are all the generic names of the TCAs. You want to make sure you know the generic names for the exam. I don't expect any of the brand names or trade names to be present. All right. Giving you time to write these down. All right. Okay. 600 nurses, pow. Right here learning about TCAs. This is what we do on Monday. This is Let's Talk NCLEX TCA examples. Now, the side effects, the major side effects for these TCAs are ABCDs. You guys with the DVD package know ABCDs. All right. And this is just my quick way of knowing those anticholinergic effects of the medication. Remar nurses in that study group, somebody needs to post ABCDs for those of you who are part of that group. Plus also, there is a big risk for suicide. There is a big risk for suicide. No, Valerie, this part of the antidepressants, I'm giving it to you today. It's not in the DVD package. I'm giving you new information, but the side effects, ABCDs, that is in the psych portion of the DVD package. So, you gotta know that. All right. So there's a risk for suicide here. Some mental status changes happen when you take this medication, and it puts you at risk. Candace says, 8:30 study group, get ready. I know that's right. It puts you at risk for suicide. So that's one of the teaching points when I was doing questions about this class of medications. Okay, here we go. You guys got that? Let's move on. Oh, another thing about this medication that I have in my notes here is that there is a very narrow therapeutic window for these medications. And so one of the adverse effects of these medications is that it can cause tardive dyskinesia. And that's really interesting because normally you don't see tardive dyskinesia with an antidepressant. Which medications do we typically see tardive dyskinesia with? Which psych medications do you see the akathisia and the tardive dyskinesia with? You guys know? You guys should know that, okay? If you have been studying with REMAR, you know there is a certain group of medications, psych medications, that have tardive dyskinesia, and it's not normally the antidepressants. So with this medication, the TCAs, you can have that tardive dyskinesia. Okay, that was just an interjection. All right. Now, the cardiac changes that you will see with the TCAs are going to be a prolonged QT interval. So look at the normal QT interval here, and this is what the prolonged one will look like. This is what a prolonged QT interval will look like. So go ahead and study on that with your notes. All right. Perfect. We're talking about the Tricyclics EKG changes. Also want to go ahead and add orthostatic hypotension to some cardiac changes here. Orthostatic hypotension, we have to tell our patients, if you take this medication, you want to slowly change your positioning. Study orthostatic hypotension. If you're not familiar with it, you guys definitely need to know what happens for the orthostatic hypotension to be positive. Okay. All right. Let me make sure I'm giving you guys everything. Okay. Client education for the TCAs. I have it here for you. We're going to give these at bedtime because they have that really big sedative effect. Give these at bedtime. They have a sedative effect. This is a slow-acting antidepressant, very similar to your MAOIs. They're going to take 4 to 6 weeks to work, so up to 6 weeks to work. If you don't take them in the right way, you think you can just take them anytime. No. It will not be well. And then, of course, you're not going to mix these with alcohol. Not going to mix these with alcohol. Okay. Perfect. Few other items that I want to add to this list for you guys is that you have to taper these medications off. The goal is that a client, you're on these, but eventually you get well enough, you do your therapy, and you can come off of your antidepressants and live without them. So when that happens, you slowly taper off this medication. You would never stop it abruptly. Now, one of the things that I noticed as well about the antidepressants is that one of the things that I noticed about the antidepressants is that sometimes if a patient has a chronic illness, then the antidepressant is going to be prescribed. Like there's a correlation, which it shouldn't be, but one of the teachings is that when a patient has a chronic disease like irritable bowel syndrome, where they're miserable, or their lifestyle changes, or diabetes mellitus, where their lifestyle changes, a TCA is sometimes prescribed with the patient who has the chronic illness. So I hope that makes sense to you guys. As a way to combat the depression that may be associated with being diagnosed with diabetes or dementia, antidepressant sometimes goes along with the medication. Have you guys ever seen that, where you have an elderly patient and you're wondering why they have chronic congestive heart failure, but the doctor also puts them on an antidepressant? And sometimes I'm like, why is my patient on this? But that's why. Some people, they take the diagnosis, they don't take it well. And so the TCA can be prescribed to go along with it. Okay. Oh, all right, cool. Now, a Remar pro tip for you guys is to know what other conditions the TCA can be used to treat. And here they are. Here they are. These antidepressants can also be used for obsessive compulsive disorder. Yes. And they can be prescribed in children for nighttime enuresis. What's enuresis? Does anybody know? Is there one? Is there one? Nighttime bedwetting. Yes, nighttime bedwetting. So you can see NCLEX points about these. Yep, you can see NCLEX points about these on your exam. Okay, all right. This video will be left up for playback for you guys to review, go over, dialogue with each other. This is a topic that you can add to your studying. You should be familiar with it. Now that you studied the content, we can do a question. Shall we? Shall we? Shall we? Shall we? What say if you guys? A client diagnosed with amitriptyline tells the nurse that he is drowsy most of the day, which is the best action by the nurse. And so now we know what amitriptyline is. We don't have to get all nervous and, oh my goodness, because we know what this is. So number one, tell the client this is a normal side effect. Request to the healthcare provider that the medication be scheduled at bedtime. Instruct the client to take the medication with food, or tell the client to stop taking the medication immediately. Ooh, studying the content is so important, because if you had not known what this medication is, you may think, well, I don't really know what the best action of the nurse is. But you guys know what it is, and everybody should have the right answer. I'm looking for it. I'm looking for it. Come on, guys. What is the most sensible, safest thing for the nurse to do for this patient? You might want to change your answers. I'm going to give you a clue. This is something that the nurse can help the patient address, because the patient is telling the nurse what? The patient is telling the nurse, I'm drowsy most of the day. I got this TCA, amitriptyline, and I am drowsy for most of the day. Okay? What should the nurse do? What do you guys think? Okay, I'm going to tell you the answer. I see the answers coming in. Okay, so the most sensible thing that the nurse should do right here, request to the healthcare provider that the medication be scheduled at bedtime. Because if we're given this medication at night, then it doesn't matter. It doesn't matter that the patient is drowsy. When you read this question, the patient is saying, I'm drowsy most of the day. So we have to make sure, because the interpretation is that they're taking it during the day, and so they're drowsy most of the day. So we have to make sure that we can talk to the doctor and say, can we schedule this for an evening? Can we schedule this for an evening dosage. Okay, so does that make sense, everybody? All right, that's going to be the best answer here, because if you picked one, you just tell the patient, oh my goodness, this is a normal side effect. So that means that there's nothing that the patient can do, and that's not true. There is something that we can try to do. Just tell the patient that, oh, this is normal. You're just going to have to be drowsy. You're going to be drowsy during the day. That's a normal side effect. If you say 3, instruct the client to take the medication with food. They can get up in the morning. They can take the medication with food. And guess what? They're still going to be drowsy throughout the day. If we do 4, we tell the client to stop taking the medication immediately. Well, my goodness, we're supposed to taper off this medication. So what would that do? Okay. So we have to think about the best choices from the options that we're given. We have to make sure we think about the best choices from the options that we're given. And you can ask the question, well, when the doctor schedule it in the evening, I don't know. Maybe they would, but maybe they wouldn't. But you as the nurse have to understand the way the medication should be given. You have to understand it. Even if we don't prescribe the medications, we still have to know all of the side effects. We still have to know how it should be taken correctly. And so if there is a question of when it's scheduled, you need to know how to address it. Okay. So that's that. Okay. That's that. Let us remember that when we're looking at these NCLEX questions, we really have to focus on the choices that we're given in front of us and being able to make the best decision from the choices that we're given. Because on the NCLEX exam, it's a timed exam. So you want to make sure that when you look at a question, you're reading it correctly. And then from the choices that you're given, you say, this is the correct answer. One of the most challenging things is when we get into questioning ourselves and deviating from the actual scenario, it takes up our time. So our Monday motivation today, phenomenal. Thank you again, Nurse Daphne, for being here. Thank you guys for studying the Tricyclics Antidepressants and taking those notes. I do expect you guys to study more, discuss it as the week goes on until we meet again for next week. Actually, what I plan to do, if you guys aren't in the Facebook group, Remar Nurses study group, you need to get into that group. I'm going to post some questions in that group, and throughout the week, I want you to do them. And then next Monday, when I come for Let's Talk NCLEX, I will be going over the answers to those questions. So our study groups are real, they are active, they are live. So look for those questions. I'll probably post them tomorrow for you guys. So print them out, do them, bring them back here on Monday, and we will go over them together. Hey, the Remar staff, thanks you guys for reaching out, for helping us to make this an easy process. My email address, support@remarreview.com. support@remarreview.com. Before I go, somebody did ask the question based off Nurse Daphne's testimonial. What is the difference between the online academy and the DVD package? So I talk about this a lot, but the DVD package is the overview. It is the comprehensive review where you get the lectures on 4 DVDs and you get 4 books that are shipped directly to you for you to study. And yes, that includes the new 5-star quick facts. You get a student workbook. You also get your homework book, and you get your NCLEX activity book. The online academy has the same video lectures as the DVDs, but you don't get 4 books. You only get 1 book, and that is the quick facts book for NCLEX. It's the 5-star book. So with the online academy, you get a downloadable workbook that you print out yourself. You start watching the videos right away. You do all of your questions and your homework and your progress exams inside of the computer system. and it's graded automatically for you in that online academy. And so there is accountability with that, because you have to get an 80% on those homework and practice exams in order to pass on to the next one. So both are really great programs, but you just got to think about how you like to study. If you're a repeat test taker or international nurse, or English is your second or third language, I strongly suggest that DVD package to help you study. This is where the majority of all of our testimonials come from. We do have others who do the online academy, but because it is 60 days limited access, you have to really be serious and focused and committed with that online program. It is intense. So if you like intensive studying, if you like challenging questions, then the online academy is for you. If you need to take your time and watch the DVDs and sit with the material, then you need the DVD program. All right. So no excuses, no matter how you like to study, no matter when you like to study, we have a program for you. You just have to get the program, commit to the 6-week challenge, and get your license in 2019 so you can be a REMAR nurse. The study group, you have to find us on Facebook, the REMAR Nurse Study Group. Love it, love it, love it. You fill out the entry questions and you will get access to an amazing group of nurses who are studying in real time for their NCLEX exam. All right. So if you want to know more about either one of those programs, please go to the website right now. It's remarnurse.com. And there you can find all the information on the products. We have a question and answer page where I'm telling you guys, you will be able to get the help that you need. So check us out again right here next Monday, 12 p.m. Eastern time. We will be doing Motivational Monday. Let's talk NCLEX. Our motto, let me see, is this: we can, we will, we must pass NCLEX for 2019. This is what we're committed to do, just like last year, just like every day here at REMAR Review. I'll see you guys later. Bye-bye. Yeah.